This week on Healthy Living, a surge in cholera outbreak globally is raising concern among experts. UNHCR urges for international support for cholera outbreak among refugees. And do you struggle with razor bumps or ingrown hair? We'll have some tips from the experts. Plus, an analysis by the WHO reveals that COVID-19 vaccination coverage has stagnated in half of African countries. We'll have these stories and more in this edition of Healthy Living. Hello, I'm Linor Moudou. Welcome to Healthy Living. It causes dehydration, diarrhea, and can lead to death. It is cholera, and it's sweeping through countries worldwide. After years of a decline in numbers, the world has seen an upsurge in the waterborne disease over the past year, according to the World Health Organization. Cholera is a highly contagious disease that affects both children and adults. Symptoms can appear anywhere between 12 hours and 5 days after the consumption of contaminated food or water. Experts say cholera can be prevented by ensuring access to clean water and basic sanitation and hygiene. However, over 1.7 billion people still do not have access to basic sanitation services, such as private toilets or latrines. Health authorities are racing to contain the outbreak of cholera that is spreading in countries worldwide. The unprecedented rise in cases has forced a shift in vaccine strategy.
Kenya has become one of the latest countries to report an outbreak of cholera. Health officials in the country have recorded at least 61 cases of the disease in 6 regions, including in the capital, Nairobi. The World Health Organization says since January this year, at least 29 countries have reported outbreaks, including 13 countries that did not have outbreaks last year, and in the previous 5 years, fewer than 20 countries on average. Experts say cholera cases have surged worldwide this year, especially in places of poverty and conflict.
With climate change and the warming of certain water places and deltas in the world, we see that the bacteria can multiply much faster. And this is why also we have much bigger outbreaks in certain places in the world. And I think this is why it's so important first to look at cholera as a global issue. Because with climate change, we know that other places can become a sort of endemic places for cholera. And secondly, because it's very important to understand that if we can prevent outbreak in places where the cholera is in the environment, we will have a much better control on the risk.
Cholera is an acute diarrheal infection that can cause fatal dehydration. It's spread by the ingestion of food or water infected with Vibrio cholera bacteria. Health officials in Cameroon say several hundred cholera cases have been detected on the country's northern border with Nigeria, with at least 17 people dead. An outbreak in Malawi that has spread in 22 districts has killed over 100 people. Aid agencies are sounding the alarm on a growing outbreak in Haiti, with more than 600 suspected or confirmed cases in the area surrounding the capital, Port-au-Prince. The disease has infected and killed people in countries like Syria and Lebanon. With the outbreaks of cholera worldwide, the WHO has reported a shortage of cholera vaccine doses, forcing a temporary shift to a one-dose strategy.
Since 2013, WHO, UNICEF, Medicines Sans Frontières, and the International Federation of the Red Cross and Red Crescent Societies have jointly managed a global stockpile of cholera vaccines to help control epidemics. However, the current wave of outbreaks is putting unprecedented pressure on the stockpile. As a result, the 4 agencies have decided to suspend the 2-dose strategy in favor of a 1-dose strategy so that more people receive some protection from limited stocks. The 1-dose strategy has proven effective in previous outbreaks, although evidence on how long protection lasts is limited.
The WHO says a few million doses of vaccines are available for use before the end of this year, partly due to a shortage of manufacturers.
Dr. Shamsuddin Abdullahi, resident doctor with the National Hospital in Abuja, Nigeria, tells us more about cholera.
It can manifest within 12 hours of contact. So from 12 hours to 5 days, averagely 1 to 2 days. Another thing that is making it so contagious is it has some genetic materials that will allow it to attach into the intestine cells, and therefore it can replicate in millions. It can replicate and one can be excreting it out. When you excrete it out, it will some other people can pick it maybe by contact with you or contact with your excreta. Usually it's settled down in water and food. And now we are having so much flooding, so it's happening now currently in Pakistan and other countries that are having a lot of floodings, and also some particular areas that has some crisis like IDP, so that's where you can see it, and also in some slums areas. This epidemic week, I think it started from the early September to this 1st October, so we are waiting for the next release of the data, and it has shown that about 42% increase from the previous month, so which means we are having some new cases that are occurring, maybe because of the flooding and other things. When it occurs, early identification, maybe from the how it manifests, then to the laboratory diagnosis to confirm whether it is a cholera or not is key. Then aggressive treatment with fluids, IV fluids, specifically like there is one solution that is specifically designed for patients with cholera. They call it DACA solution. But in absence of that, most common one that is always available, maybe the Ringer's lactate. Then you can give also the ORS, oral rehydration solution. It's very important. If you have this IV fluid, aggressive IV fluid with antibiotic and ORS, so it can be controlled. Then for prevention, if there is a safe supply of water for the community, also one has to, personal hygiene. Then another thing that is very important is the vaccine. I think there is about 3 vaccines that are available for the cholera. So it's one supposed to take at least 2 doses for it to be effective. However, there is one of the vaccine that currently, I think in this October 2022, the organization or the community that are responsible for distribution of these vaccines, they have agreed that one of the vaccine can be given one, and it's shown to be very effective because of the outbreak of cholera that is happening all over the world. So that's why they are having maybe shortages. That's why they consider reducing the doses so that other doses can be diverted for the purpose of intervention where there is outbreak. In terms of disaster like this, if you cannot have safe drinking water, at least even if you are getting your water directly from the river, so you can boil it or you can add some chlorine in it to kill the cholera in the water.
UNHCR has urged for international support to combat the cholera outbreak among refugees in Cameroon. The UN Refugee Agency says up to $250,000 is needed to increase access to clean water, improve waste management in the camp, and address other urgent needs. I spoke to Olivier Beer, UNHCR representative in Cameroon.
What we are doing also is to sensitize refugees about waste management and the importance of using latrines when we have them. Because another gap that we have a gap of 900 latrines. Our refugee camp was designed at the beginning for 20,000 refugees maximum. But we had 30,000 and now we are at 75,000. But with the same budget that we had 5 years ago with 30,000 refugees. Refugees are here for quite some time, not only the Nigerian, but also the Central African, and it's very difficult to get humanitarian funding for protracted refugee situation. But it does not mean that refugees are already able to fully take care of themselves. Why? Because these regions where usually are refugees are remote areas where development is also missing. We are confronted with development challenges that we cannot address. To respond to cholera effectively, what I have seen, my experience is that you need a series of things to happen, a series of response to happen, because it links to the numbers of latrine, the numbers of medication, the numbers of the availability of potable water, waste management, sensitization, entrance, catheters, all these things. So what we need to do is to make sure that everything will be addressed, will be responded to, and then you can afford to have one dose of vaccine because you have potable water, because refugees know that they have to use the latrines, because you have enough, you have sufficient health personnel that we don't have for the moment. I'm more optimistic because I've seen that for this particular outbreak, we managed to work all together. So if we are developing leadership, coordination, and we have enough resources, I'm very optimistic that this can be not only solved and responded to, but prevented. Because floods are happening every year. We know the problems. We know the context in which we are living. We can, today in 2022, in a country like Cameroon, we can avoid cholera. On the donors, on everyone assisting us. Of course, I thank already for the support that we are getting, but I want to say it's not enough. We need more. We count on the states. We count on the donors to help us more, because we don't want this to happen next year.
Do you struggle with razor bumps or ingrown hair? If the answer is yes, you are not alone. Many people experience ingrowns or razor bumps after shaving. This occurs when cut hairs start to grow back down into the skin rather than growing out above the skin. Experts say ingrown hairs often look like skin-colored or red bumps. They can be painful. Pus-filled bumps often get worse the more you pick at them and leave some marks on the skin. To prevent ingrowns or razor bumps, experts recommend exfoliating with a gentle scrub or a cleanser containing glycolic or other alpha-hydroxy acids before shaving, as doing so can reduce the layers of skin covering where the hair is growing. Applying a warm, wet washcloth to the skin can help soften the skin and draw the ingrown hair out. Try another hair removal techniques such as hair removal creams and laser hair removal if accessible to you and safe. If all fails, consult with a doctor or pharmacist who can recommend adequate over-the-counter or prescription treatment. COVID-19 vaccination coverage has stagnated in half of African countries, while the number of doses administered monthly declined by over 50% between July and September, according to an analysis by the WHO. The findings reveal that although Africa is far from reaching the year-end global target of protecting 70% of the population, modest progress has been made in vaccinating high-risk population groups, particularly the elderly. Overall, as of 16 October 2022, just 24% of the continent's population has completed the primary vaccination series, compared with the coverage of 64% at the global level. Liberia has now joined Mauritius and Seychelles as one of 3 countries to surpass 70% of people with full vaccination coverage. Rwanda is on the verge of achieving this milestone as well. Meanwhile, experts are turning their attention to a pair of new variants that are steadily spreading, BQ1 and BQ11. Both are from BA5, an Omicron subvariant that currently accounts for about 68% of COVID-19 cases in the U.S., according to data from the U.S. Centers for Disease Control and Prevention. In a study posted online in October, researchers found that BQ11 is able to evade antibodies from past BA5 infections. That's our show for today. For more health news, wellness tips, and medical breakthroughs, stay connected to Voice of America at voaafrica.com. You can follow me on Twitter at Linor Moudou. Until next time, stay well and strive to make every day a healthy day.
Latest entrant, latest technology. Welcome to Intel 4G LTE Advanced and experience super fast internet access today. Visit intel.com.ng or any of our stores in Lagos, Abuja, and Port Harcourt to get started. Intel. Live more.
It is estimated that more than 1,000 people die each year in sub-Saharan Africa because of counterfeit drugs. The menace of these drugs is creating medicine insecurity, which now calls for urgent attention from relevant agencies to tackle the dangers posed by these drugs. Welcome to What Matters. My name is Nneka Michael. In today's episode, we zero our focus on counterfeit drugs, consumers' knowledge of counterfeit drugs, consequences, challenges in curbing counterfeit drugs, and an interview with an expert on counterfeit drugs. Stay tuned as we bring these segments to you.
The video you're watching went viral on various social media platforms, and it says a lot about the prevalence of counterfeit drugs in our society.
I opened the tetracycline and poured it in a container, and what I perceived immediately was like spice. So I'm like, is this how they do tetracycline now? Let's confirm something. Bring it, let me show you. Open one and pour it. Don't worry, I'll pay for it. I just want you to know so you know where you buy your medications from. Is that the color of tetracycline? Have you perceived it? Mm. It's like spice.
Check another company.
Mm-hmm. So this was the company you gave me, right? Mm. Is it Naptrine or Naptene or whatever? Tetracycline. Okay, open another one. Let's see. This is the correct one. I think you've seen the difference. Mm. I've helped you to know. So someone don't buy herbs from your chemist and go and fall sick. Okay. My husband has told me of how someone drank tetracycline and he affected the liver and the person died. I was asked to take it for these people on my face. And when I started, that one I didn't buy it, someone gave me from a different pharmacy on Mara. When I started drinking that, I started feeling like congestion around my chest. And I stopped taking it. I don't know why I just stopped. My spirit just said, stop taking it. So, and I met all these, just a normal person. I've met like two of them. They said, I should rather take tetracycline and mix with palm oil and apply on my face. So that one said, use it with honey and apply on your face than drinking. That's why I came to buy from you. But when I opened it, person with that, it smells like spice, like real spice. Meaning it's fake. So don't buy from this company again and save people's health. This is the correct tetracycline to be used.
According to research, more than 1,000 people die each year in sub-Saharan Africa because of counterfeit drugs. And in light of this threat, we conducted a vox pop to ascertain the extent of public awareness of counterfeit drugs and personal experience. These were the outcome.
I have been a victim somehow when I had malaria and I took a particular drug thinking it is the malaria medicine I'm supposed to take. So I don't just want to mention the name. But then at the end of the day, thing wasn't working out. So my feeling about counterfeit drug is like someone deliberately poisoning other person.
I wouldn't say whether I bought or not, because if I buy a drug and it refuses to work, maybe I change the drug or I go back to see my doctor. So I've not really been cautious.
While there is evidence of people purchasing counterfeit drugs, it is worth noting that there is a positive knowledge of these drugs because of the awareness carried out by the various agencies that supervise the manufacturing, distribution, and sales of drugs in Nigeria.
Me, I use two things to dictate. One, I check the NAFDAC number. If it's registered, you have where you scratch and you can type the number to confirm that this company is registered and the expiry date. So I check, and I don't go to this roadside pharmacies to buy. Go to a well-organized pharmacy that I know that this shop is a well-known shop and it's been registered.
If I want to buy drugs now, I used to check this NAFDAC registration window. They have NAFDAC number there. The expiry date, date of this thing, the date of this thing, the drug, the date the drug is made, and the expiry date. Especially these NAFDAC people used to put this thing there, registration there.
I will not say one can by mere looking at it. You just have to experiment it to know that this one is counterfeit or not. But most times, I believe that there are pharmacists that can at least detect it as well, that this one is counterfeit compared to the original. That's just.
This awareness goes back to the days of late Dora Akunyili, when she superintended over the National Agency for Food and Drug Administration, NAFDAC.
Well, actually, the advert really was on the public domain, especially during the time of late Dora Akunyili. So it was during her time that consciousness was really put into people.
Other agencies have equally contributed to creating awareness of counterfeit drugs in Nigeria, and they have devised various means by which fake drugs can be detected. Despite these efforts, lots of consumers still fall victim to purchasing these substandard pills, and when taken, they result in untold consequences for the victims.
After taking some doses, the effects, instead of dousing the pains, it increases the more. So that is how the guy now spoke to, he was complaining, and I look at I now said, okay, let me take a look at it. I saw it, but the packaging was not like the normal paracetamol that I used to know.
It, however, means that not much is being done to arrest the situation, especially in the distribution of these items to save lives.
It is heartwarming to know that there is awareness of counterfeit drugs in Nigeria, meaning that the agencies responsible are doing a great job. On the other hand, consumers are calling for effective surveillance of the sales of counterfeit drugs. When someone purchases a counterfeit drug and takes it, the consequences are life-threatening. Our next feature looks at the effects of these drugs on consumers.
Living with substandard drugs in circulation is dangerous and unhealthy in society. The reason being that the composition of these drugs is with poisonous substances that are contaminated with toxic doses of dangerous ingredients. There are reports about people consuming counterfeit drugs who end up having severe consequences.
Some drugs that I bought drugs for ulcer, but the drugs is not work for me. And I know that the drugs is already expired, and they are selling it inside the shop. I don't know whether NAFDAC, they check them, I don't know. So I buy the drugs, I drink it, but the thing no work, is adding my sickness.
Apart from the health effects that counterfeit drugs can cause, this set of drugs also has a toll on individuals' economies as well.
It can lead to death. Yes. If somebody is sick, of course, it's going to affect the person financially, because the money you are going to use to treat yourself, you start spending it. If it's money you are going to use for business, you find out that you start putting it into the treatment just to cure yourself.
Fake drugs can even make what you are trying to treat worse. It can make you worse. It can even lead to death sometimes. So yeah.
Rather than cure the disease, counterfeit drugs enable the disease to be resistant to drugs, requiring the use of multiple drugs and spendings by the victim. But why are people patronizing counterfeit drugs?
I think people go for cheap articles most times. They prefer buying the cheap ones. And equally, we Nigerians, sometimes we go for cheap things that will not even yield us anything. And masses sometimes, they also like going for all those cheap ones. Like people that don't really have. So they go for those cheap ones. But it's not the best.
Most of the drug sellers, they are not fully educated enough to selling drugs. You know, selling of drugs, you need to be educated first. You have to study in that particular drugs. As a pharmacy, you have to be educated. You must know about health. By the time you go on health, you study health, then you know the kind of drugs you're supposed to be selling.
Why I think there are still counterfeit drugs in the market is that people are, okay, like youths now, jobs, people are not able to get jobs. So people are ready to do anything to make money. That's what I feel.
In this scenario, it is obvious that mere awareness of counterfeit drugs would not be adequate to protect end users from the dangers that comes with these drugs.
There is no positive outcome with counterfeit drugs, but negative consequences. And that is the more reason why this activity must be stopped. Let's go on a break. What Matters will be back in a moment. Glad to have you back. Now, it is a known fact that there is good awareness of the circulation of counterfeit drugs, which is proof of good works being done by the government. But on a second thought, you will ask why these drugs are still found or purchased over the counters. Our next feature examines the challenges in curbing counterfeit drugs in Nigeria.
It is reported that an estimated 1 in 10 medical products in low and middle income countries are counterfeit. The most common drugs counterfeited are malaria and antibiotics drugs because of their high prevalence amongst Nigerians. Also, in most developing countries, drugs are sold in open markets like other products you can purchase easily in the markets. And with this situation, it will be difficult to put a check on substandard drugs brought in for sale. Unfortunately, wholesalers and retailers go to these markets to purchase drugs that are sold to consumers. Another challenge to curbing counterfeit drugs is the new method of sales on the internet. where half of the medicine sold may be counterfeit and lack surveillance. The complex nature of the supply chain is another Herculean task in curbing counterfeit drugs. Some of the drugs produced outside the country go through multiple exchanges between manufacturers and end users, thereby creating a tall task for surveillance by the relevant agencies to spot these drugs in transit. To curb this illegal trade, effective enforcement and community engagement are needed by all stakeholders in the industry.
What a complex situation. No wonder why it is difficult to prevent illegal trade. Let's find out what the Pharmaceutical Society of Nigeria is doing to curb illicit drug sales in Nigeria. Thank you so much for joining us. Please tell us, how common are counterfeit drugs in Nigeria?
Counterfeit drugs is really a menace against the practice of pharmacy in Nigeria. It's actually very prevalent and is continuously on the rise. There are many reasons why it's so, because the purchasing power of the average Nigerian is continuously going down, and there is an unhealthy competition between the genuine drug and the counterfeit drug. So because of that gap, there is continuous increase on this counterfeit drug in our drug market. So many people, these fraudulent people that bring it in, they thrive on the fact that it's creating market for them, and it's frustrating the genuine drug because they seem to be cheaper than the genuine drug, but in the long run it's really not cost effective, because it makes us to waste resources, and then at the long run the person doesn't get the result he ought to get. The cost becomes, you pay more for the same result you want to achieve.
Which of these drugs are more commonly counterfeit?
Actually, there is no particular drug that is free from being counterfeiting. But from experience, there is much more counterfeit drugs that are coming up on class of drugs like antibiotics, because there is more indications for these drugs, and we discovered that most of these drugs that are being counterfeited are actually those from the premium companies, and they are a bit expensive in a way. So what these people do is they produce something to mimic these drugs, the fake ones, and pretend to make it cheaper, and in the long run make the average Nigerian compete with leave them with the option of choosing either the genuine one or this fake one, in the sense that they think it is cheaper, but in the long run it is actually not cheap.
What are the components that can make a drug counterfeit?
Okay, once a drug does not contain the active ingredients that it's supposed to contain, which is what makes it a drug actually. If it doesn't contain it in its right quantity, right concentration, it doesn't contain the excipients that it's supposed to contain, it contains anything different from what is documented that that drug should contain, it is counterfeit, it is fake, it's a fake drug.
Can you tell us what are the social and economic consequences of counterfeit?
It is not economically good for the country, neither is it social. The social impact is that it makes the average Nigerian to think that everybody, even the people that are genuine, is not trustworthy. Because if you're a victim of these fake counterfeit drugs, and maybe it causes the death of a family member, how do you trust anybody that is coming around you with drugs? So that's the reason why we need to sanitize the system, and that's what my organizations are trying to do, to curb all of this, so that people will get genuine drug, get the therapeutic goal that they want to achieve, get the results that they have stayed with the minimum time, and get the effect they want to go home.
How can we avoid purchasing counterfeit drugs?
The best thing that anybody can do while sourcing your drug is to go to the pharmacist. The pharmacist is the custodian of drugs. That pharmacist has been trained all the way on how to keep the drug, For instance, if you're getting a vaccine and you get it from just the merchants around, these vaccines are supposed to be kept at a particular temperature, even some eye drops. So if you don't get them from such genuine source, you could equally get even the quality ones, the genuine ones, but because they were not kept in a good condition to ensure that these drugs are intact and they are still good for consumption, you could be getting poison because the process of metabolism can happen while you keep these drugs in a wrong environment. So the ideal thing to do is to go to your pharmacist when you're looking for any drug and consult your pharmacist. That's what we call pharmaceutical care. All of this is to ensure that the patient gets the best result from getting a drug. You meet the pharmacist, he gives you counsel on what you need and how you're going to get, even the one you're going home, the drugs you're going home to continue to take. The pharmacist will help you to tell you the condition you will keep these drugs in your house so that you ensure that throughout the process of this treatment that you get the best that this drug can give you.
What is your association doing to curb counterfeit drugs?
What our association is doing, and pharmacy space generally, is that there's awareness, like what we're doing right now, enlightening the public that there is something, because if you don't know that this thing exists, you wouldn't even know how to avoid it. That there is something that you should do when you want to get a drug. Go to the person that is licensed to handle drug, and that's your pharmacist. Your pharmacist has been trained. He knows what the drug you need for each particular ailment. He knows the side effect. He knows drug-drug interaction. He knows how these drugs are metabolized in your system. He knows every process that is involved in this drug, including the manufacture of the drug. Then when the patient is given this drug, you are expected to achieve the therapeutic goal when you take the genuine drug. So when you now take what is not the drug or anything, counterfeit or substandard drug, you will not get that result. So because we know this, the pharma space generally, my president, for instance, is equally going out of his way to see that we curb this menace in our farm industry and the pharmacy space entirely. One of the things that my association is doing is that there's awareness, and then they are strengthening the regulatory body. The regulatory body, the Pharmacists Council of Nigeria, PCN, and NAFDAC. Now, what these two regulatory bodies does is that they try to harness the process, the whole line, the value chain of this drug, right from manufacture. That's what we call good manufacturing practice.